So hello and welcome everyone to this MSSO webinar, Standardized MedDRA Queries. My name is Suzanne Insur Shaker or Shaker, both pronunciations are correct. I'll be your instructor for today, and I'm joined by my colleague Hannah Eaton. Hannah is an MSSO training coordinator, and she will be kindly facilitating the session today. So starting with some introductions, I am a medical officer with the MedDRA MSSO team. I'm based out of New Jersey on the East Coast of the United States. Prior to joining the MSSO, I've had about 20 years experience in the industry with different pharma and CRO teams within various functional groups. And although this particular webinar is not centered on interactive sessions, we will be using the PollEV tool in certain sections. So this is the link to the tool that you see on your screen. It is anonymous, so even if it asks you for a username, you can skip that or just use MedDRA123 or just scan the QR code to access. The logon information is also available in the chat feature of the GoToWebinar, and this will just help us get to know you a little bit better, starting with the question of where are you joining us from today? So it will also give you the chance to test the tool so that we come to the polls, you'll be able to participate and answer some questions. And like we said, it is anonymized. So when we get to the polling questions, we won't know who's giving the responses. And it's always fun to see the pins as they pop up on the map. So thank you for joining. A few housekeeping items while we get the responses coming in. The webinar is scheduled for 2 hours. We do have a lot of information to cover. Hannah will be monitoring the chat. So as we go through the slides, if you have any questions, please post them in the chat as the questions come to you. Hannah will bring them to my attention, and we will also leave enough room, hopefully at the end, for Q&A. It is fun to see different pins in different parts of the world. I think it shows that MedDRA truly is a role player in interconnectedness globally when it comes to human healthcare and safety of medicinal products. I'm always tempted to stay on this screen to see more pins, but I don't see a lot of pins yet, so I'm wondering if maybe folks are not able to access the tool. The QR code is visible on the top right corner of your screen. So if you need that, QR code is visible there, and the link is also on the top left. So maybe give it a few more seconds just to make sure folks can access the PollEV tool. Okay, for interest of time, I will move on, but I do hope that folks are not having trouble with the tool. If you are struggling to get into the PollEV tool, please just send a chat to Hannah and she'll walk you through it. Okay, just to get to know you better, just curious about what roles and functions you perform, whether in your current organization, in previous lives, and you can select as many as apply to you, just to give us an idea of the type of functional teams we have on the call with us today. And usually we do see folks from coding teams and safety teams. It's good to see folks from regulatory authorities and folks doing medical review or safety assessments. Data analysis, happy to have you. This is a good webinar for you, and academia. So welcome everyone. And regarding experience with MedDRA, whether it's coding experience or analysis experience, if you could let me know, are you familiar with MedDRA? Are you new to MedDRA? Okay, so good to see that it's really covering kind of the entire spectrum of familiarity levels with MedDRA. And we do offer a webinar specific to data analysis and query building with MedDRA. It is definitely not prerequisite to attending this course or understanding this course, but it does offer details on query building with MedDRA and customized queries with MedDRA, which is not a topic we will cover in detail today. So if that's a topic you're interested in, the webinar for data analysis and query building with MedDRA will address that. But I'm glad to see that we do have folks who have attended that webinar. So, all right. So thank you everyone for making the time in your day-to-day to join us. Our first slide is an introductory slide that we offer on all our webinars. It reminds us that MedDRA was created under the auspices of the ICH in the 1990s. In fact, and I like to give this quick look, when you go to the meddra.org website, on the top right-hand corner, you'll see the ICH logo here in blue, and that takes you to the ICH website. And under the work products for the all guidelines for ICH, I'm sure all of you with us today are familiar with the quality guidelines, the safety guidelines, the efficacy guidelines, where you see the GCP guidelines and the E2 guidelines for pharmacovigilance like E2BR3 and E2C and E2F. You also see multidisciplinary guidelines. And the first M1 ICH MedDRA ICH-IC multidisciplinary guideline is MedDRA. So MedDRA is an ICH standard, and the ICH website shows the implementation status of MedDRA across the different ICH regions. I like to show this just to kind of clarify and bring home the fact that MedDRA is an ICH standard and ICH guideline. Okay, so going back to the slides. The MSSO stands for MedDRA Management and Support Services Organization. We are the repository, maintainer, developer, distributor, and trainer of MedDRA. All of these activities are overseen by the ICH MedDRA Management Committee, which is composed of the 6 ICH parties, the MHRA of the UK, Health Canada, and the WHO as observer. This is our copyright and disclaimer notice. The first bullet point basically states that just like MedDRA is owned by the ICH, these slides are also owned by and copyright protected to the ICH. The slides have been shared with you and they are available to you that you can use them other than the ICH and MedDRA logos, so long as you acknowledge the copyright and don't make changes. However, if any changes are made, they must be clearly identified, and you must not infer or imply that these changes were in any way endorsed by the ICH. The second bullet point is legal verbiage regarding disclaimer, that the slides and the presentation are provided as is without warranty. And the last bullet point basically excludes any third-party material from the above-mentioned copyright permissions, but will not apply today as we don't have third-party material. So what we'll be covering today in today's course will be the principles of an ICH-endorsed guideline for use of MedDRA in data retrieval called the MedDRA Data Retrieval and Points to Consider document. We're going to discuss features of the SMQs, talking about their background and characteristics, the impact of MedDRA versioning on SMQs and their benefits and limitations. We'll do a demo of the SMQ analysis tool embedded in the MedDRA browsers. And in the chat right now, you do have temporary credentials to the MedDRA browsers that you can use if you like to click along with us as we do the demo. We'll talk about SMQ applications and offer 2 clinical scenarios to reflect the applicability of SMQs. We'll touch base real quickly on the creation of customized searches, but we won't go into detail because, like we said, it is offered in that separate webinar on data analysis and query building with MedDRA, and we'll conclude with Q&A. Okay, so let's start with that ICH guideline. So ICH has created an ICH-endorsed guideline that really provides data retrieval and presentation options for use by the industry and for regulatory purposes. Of course, the most effective use of this document is in conjunction with the MedDRA term selection points to consider document. And when we say term selection, we do mean coding, because when you are coding with MedDRA, basically what you're doing is you're selecting an existing term within MedDRA at the lowest level. So it's the lowest level term in MedDRA, or what we call the LLT. That's coding with MedDRA. That's term selection. And it is highly recommended that every organization has their own organization-specific guidelines for data retrieval and presentation. And those guidelines should be consistent with the guidelines and the principles offered in this ICH endorsed guide. And I do want to show you where you can access that guide. So let me take you back to our website. So this is our MedDRA.org website. There's two ways that you can access that ICH endorsed guideline: under how to use support documentation. You can select the language of preference if you are familiar with a language better than English, or keep it at English. And under the blue banner on the top, if you click that open, you're going to see the points to consider guidelines, the different ones offered by the ICH, which are ICH endorsed. So the first one is the MedDRA term selection for coding. And here you'll see the MedDRA data retrieval and presentation, of course, offered in different formats, including red line versions compared to the previous release. And then you have the companion document as additional details for coding. And you have MedDRA best practices, which touches on the options for upversioning in MedDRA, if that's a topic of interest to you. The gray banners are version specific, and they are released with every version of MedDRA. So you'll see the What's New document that talks about the new release and what changed compared to the previous release. You'll see Introductory Guide to MedDRA, which is really useful for coding. Introductory Guide for SMQs, which is a very interesting document with details on each of our SMQs, and then a technical document for the up version. So I just wanted to show you where you can retrieve this ICH endorsed guideline. This guideline is developed by a working group of the ICH Management Committee. It's released yearly in March. Even if there's no changes, then we just upversion the date. And it's released as a complete version in the 6 languages that you see on your screen, and condensed version in 9 additional languages. And it's available on the MedDRA website, like we showed you, and the JMO website. And JMO is the Japanese maintenance organization tasked with maintenance of MedDRA in the Japanese language. So the types of topics addressed in that PTC guideline is really wide. So it starts with general principles that are covered in detail in that other webinar. So we will just touch base on them real quickly. In terms of quality of source data, of course, we all know good quality output relies on good quality input. And here, data input is twofold. You have the originally reported term or sourced data, or your natural language term, and you have the coded data. So it is very important that source quality is carried through the coding process by consistent and appropriate term selection, as the coded data is the basis of data presentation, data retrieval, and data analysis output. Of course, the document stresses the importance of documenting organization-specific guidelines like upversioning decisions, reproducible data search strategy, creating and maintaining customized MedDRA queries, quality assurance, and ensuring that these are all consistent with the ICH endorsed points to consider document. The third general principle about do not alter MedDRA is one of the most important takeaways of any of our webinars. MedDRA is a standard, so it's an ICH standard. It's a standardized terminology with a predefined term hierarchy that should not be altered. So users must never make ad hoc structural alterations to MedDRA, like changing the primary SOC allocation, even if someone asks you to. Because if you change the primary SOC allocation, you're compromising the integrity of the MedDRA standard, which is the standard used by your other sister organizations, the other subscribers, and all the regulatory bodies. But if you do find that there's a term that may need a better placement in MedDRA hierarchy, you can submit a change request to the MSSO for review. The fourth principle talks about organization-specific data characteristics. So even though MedDRA, like we said, is a standardized terminology, different organizations can implement MedDRA in various ways. For example, different organizations may differ in database configuration, where some may allow upfront display of the secondary hierarchy, others may not. Some may facilitate data storage of all levels of MedDRA, including the HLT and HLGT levels, and we'll show a slide that talks about the levels of the MedDRA hierarchy. And some may be restricted to certain levels of MedDRA. Some organizations may use synonym lists, And some of those synonym lists may be applied on a global base or study-specific base. Some organizations have their own approach to legacy data conversion and data mapping standards. So that's the impact of organization-specific data characteristics. In terms of characteristics of MedDRA that impact data retrieval and analysis, think about, for example, MedDRA hierarchy, grouping terms in MedDRA, like we said, the high-level term, HLT, the high-level grouping term, HLGT. Also think about the concept of multi-axiality in MedDRA, that the same preferred term may be linked to more than one system organ class. Think about also that some system organ classes are uniaxial. They only have preferred terms linked to them. All of these topics are covered in earlier webinars, so we don't have really the time to delve into them in more detail. So please investigate other webinars if you're interested in more details on MedDRA hierarchy, like our coding webinars and what is MedDRA and how is it used. MedDRA versioning options and practices is another general principle, and we'll discuss that more in the next slide. The focus of today's slide will be the last two topics here, the last two principles for SMQs and customized searches. General queries and retrievals is covered in that other webinar for data analysis and query building with MedDRA. So let's talk about MedDRA versioning in a bit more detail. So MedDRA is updated twice a year. We have a March release, which is considered a complex release. And it's called complex because it potentially could have changes in all the levels of the MedDRA hierarchy, if applicable. The September releases are considered simple releases because they only include changes at the LLT and PT levels in those releases. The version you use when you're doing data retrieval and analysis is one of the most important parts of your documentation practices. So it's very important to note which version you used in coding, which version you used in analysis, and for them to be the same when you're comparing the data you coded. Of course, we offer a lot of resources to tell you what changed with every release of MedDRA. We showed you that's what's new document under that gray banner. We showed you where the MedDRA best practices under that blue banner. And with every release, we send the users a packet. Basically, it has the MedDRA files. It has a version report that compares the newest release to the one right before it. And we offer you a tool called the MedDRA Version Analysis Tool. And we'll talk a little bit about this tool. So it is a web-based tool. It's available to all subscribers, so it's free. And it gives you the option to do three kinds of searches. The first one is that you can run your own version report, and you can not only run it the way we submit it to you with every version release against the last version, you can actually compare any two versions of MedDRA. So if you have data that was coded, for example, in version 25, and now you're at version 28 and you're interested in analysis, you can actually run a version report comparing 25 to 28 and see what changed in those two versions that could impact my data. You could upload your own coded data into this tool and again compare it to any other future versions of MedDRA that were released after your data was coded, or even compared against supplemental data that hasn't yet been officially released but has been approved for release. And you can search on an individual term basis. So all of these are available to you as actions within that tool. The tool allows you to change your interface language. It allows you to make your comparison in any language of the MedDRA supported languages that we offer. And you can, like we said, you can run reports on supplemental changes. You can also run reports on secondary system organ class changes. So I know it sounds a lot of details on that tool. Unfortunately, this webinar is not intended to demo the MedDRA version analysis tool, but we do have under the link available to you under our training tab on the meddra.org, there is materials available to you to show that tool. And let me just show you real quick. So here's our training tab. And under the training materials, under tools, if you scroll down a little bit, there's our MVAT tool. And there's a two-part demonstration in English that's really well constructed, that walks you through all the actions that you can do in MVAT, and of course offered in a few other different languages. Okay, so let's jump into the topic of our discussion today, SMQs. But just a few questions or polls before we get started. When we do data coding, which level of MedDRA do you think is the one we usually use for data coding? And I'm going to just give a few seconds just to kind of gauge if folks are familiar with the jargon that we use when we talk about MedDRA and the MedDRA hierarchies. Okay, so let's see responses. Okay, this is very good. The majority of you do have it right. So when you're coding in MedDRA, you are coding to the LLT. How about when you are analyzing in MedDRA? When you are analyzing in MedDRA, which level of MedDRA is this usually done for analysis? And just giving it a few more seconds just to get a few more responses in. Okay, so let's see. Okay, again, the majority of you do have it right. So the preferred term is the term in MedDRA that is usually used for analysis. Folks who picked anything else are not technically wrong. The grouping terms in MedDRA, like the HLT, the HLGT, the system organ class, they can be used for sure for data analysis in MedDRA. And the LLT has its uses. So the LLT is the most granular, it's the most detailed term in MedDRA. It has a lot of details in it that may not be always useful when you're aggregating data. But in certain instances, like for example, in infections, if you drill down to the LLT level, you're going to see the species. And if that's of interest to you, you can, for certain, use it in your analysis. But typically, the preferred term is the term that you use when you're presenting your data, when you're submitting your data to the regulators, and when you're analyzing your data. And in terms of SMQs, how many do you think right now as level 1 SMQs exist in MedDRA? And you don't really have to know a number. If you don't know, you can just guess. And some folks maybe will guess all of them. But let me give it a few seconds just to see what kind of responses we're getting. Okay, this is actually something we see on this slide in previous webinars as well. So the majority think is between 100 and 200, and then the rest is kind of all over. So you'll see that number in a few slides coming up. But let's talk a little bit about what is a query. A query is basically a way to answer a safety question. So a query is a defined collection of specific terms from MedDRA, typically at the preferred term or the PT level for analysis, that are related to a specific area of interest, maybe a defined medical condition. The way queries work is you would look through your own database, as shown by the diagram on the left, and you're looking for these defined PTs in MedDRA. Now, we said the coded data is usually at the LLT level, but for analysis, the query is built at the PT level. And that's perfectly okay, because the LLTs in your database are subsumed in any relevant PTs. So if a query retrieves a PT, it will also be looking for any LLTs subsumed under that PT to reach a hit or identify cases. Standardized MedDRA queries work in the same way. So these are groupings of MedDRA PTs related to a defined medical condition or area of interest that are intended to aid you in the identification and retrieval of potentially relevant ICSRs or cases. SMQs are used to support signal detection and monitoring. They're validated, they are standardized, and these set of terms have undergone extensive review, extensive testing, analysis, and expert discussion. And they represent a variety of safety topics of regulatory interest. The terms in an SMQ may come from one or more system organ class as long as they are relevant to the medical condition of interest. So they could represent signs or symptoms of a condition. They could represent the actual diagnosis itself. or the syndrome itself, or physical findings that may be relevant to that condition, or lab findings that may be relevant to that condition, or procedures that were done for that condition. So the whole point is to identify cases to help answer a medical question or a safety question, whether this is for summary and analysis of clinical trial data, whether it's for pharmacovigilance, medical information questions, maybe a query from a regulator or other purposes. This is a list of, well, this is not a full list. This is an example of SMQs that we have in production. So as of now, as of version 28, we have 110 level 1 SMQs. So the majority were correct because the majority picked between 100 and 200. So the slide only shows an example of these, but from a quick look, one thing they all have in common. They are conditions you would really rather not see in a population of subjects exposed to your product, whether that product is a drug or a device or a vaccine or anything else. You can also see the example of pregnancy among the SMQs because you really would want to know if exposed subjects become pregnant. You see an example of lack of efficacy or lack of effect because you would want to know if your product is not achieving the effect that it was intended for. Each of these 110 SMQs are detailed in this document that we showed you in that gray banner, the introductory guide for SMQs. And just because it's a really good document, I want to take you back to our website under how to use and support documentation. We said there's a second way to get to these same documents. It's on the top quick links here. So we have a couple of quick links here on the top. In the middle, you're going to see PTC for PTC documents. If you click on that, it will take you to the exact same place, but with the blue banner defaulted open. So we said introductory guide for SMQs is a really useful document for you because basically it has a bit of introduction about how SMQs were built, what their purposes are, and then it gives you more detail about individual SMQs. So if I expand the list of individual SMQs and, for example, take you to acute pancreatitis, you'll see just a couple of pages. I mean, each SMQ only has a couple of pages, so it's not hard to read up about an SMQ that you're interested in. The full document is really big, but each SMQ is only a couple of pages. So it starts with a definition. It walks you through what were the inclusion and exclusion criteria to this particular SMQ. It might exclude some terms that are not relevant for this area of interest because remember, we're interested in subjects who are exposed. So this is really focused on product exposure medical conditions rather than, for example, infection-associated medical conditions. And then it will tell you what type of SMQ this is, and we'll touch base on the exact types of SMQs. But if there's an algorithm involved, it will walk you through the details of the algorithm to allow you to share that with your programmer, if you like, to recreate the SMQ in your own database. So it's a really nice snippet of what you get from that document. And it also gives you the list of references that were used when the SMQ was constructed. Okay. This next slide talks about SMQ data characteristics. We'll go through them all in detail one by one, starting with the MedDRA term inclusion. So we mentioned that SMQs are built at the PT level, and they will include all the LLTs subsumed under the relevant PT. But just in case we have folks on the line that may not be too familiar with the levels of MedDRA hierarchy, just a quick summary. MedDRA hierarchy is composed of 5 levels. When you're coding in MedDRA, basically what you're doing is you are selecting a MedDRA term from the lowest level term at the bottom of your screen. These are the most granular, the most numerous, almost about 90,000 through version 28. They are intended to give options of selecting the LLT that is the closest match to your reported verbatim. But many of these LLTs are really sibling LLTs. They really convey the same medical condition. So think, for example, if one reporter says the patient complained of abdominal pain, maybe another reporter will use the words tummy ache. Maybe a third will use belly ache, abdominal cramp, abdominal colic. All of these are sibling LLTs that they mean the same condition. One of these LLTs is kind of preferred to the rest, is selected to represent this unique medical condition, and this would be the preferred term. So one of these LLTs is chosen to be repeated at the PT level. And in the example that I told you, that would be abdominal pain. So you see abdominal pain at the LLT level, and you see abdominal pain at the PT level, but the numbers have constricted. So you go from about 90,000 at the LLT level to about 27,000 at the PT level. And then we start grouping. So MedDRA starts not only standardizing at the PT level, but it starts aggregating, because PTs that are related to each other get aggregated or grouped together under these grouping terms, starting with the HLT, the high level term. And this grouping happens in a medically meaningful way. It could be based on anatomy or pathology or physiology or function. And the HLTs themselves also get grouped together in a medically meaningful way to the HLGT level, to the high level group terms. And the HLGTs themselves are also grouped into 27 system organ classes. And this grouping, this final grouping, is either by etiology or manifestation or purpose. So now you see how signals are getting condensed in MedDRA, starting from the natural language verbatim being coded at the LLT level, and then all these counts getting smaller and smaller until you reach only 27 system organ classes. In many organizations, the summarization and analysis starts at the PT level. So it's a very important level. And like we said, this is the level that can be used in reporting and regulatory submissions. The second characteristics of the SMQ talks about narrow versus broad searches. So this approach accommodates those instances where a user may need to identify cases that are highly likely to represent the condition of interest. That's your narrow scope. It's the most specific. However, if you are interested in a broader approach, a broader scope, you can expand your sensitivity. So a narrow search yields more specificity. A broader search yields more sensitivity. The broad search itself does not exclude narrow terms. The broad search tells you that I'm still looking for the narrow, specific terms that speak to that condition, but I'm also including maybe some signs, maybe some symptoms, maybe some lab findings that may or may not be due to this same medical condition. So when you run your data against the SMQ, you have the option. You can select a narrow search only, which will be very specific. But if you want to cast your net a little bit wider, you can select a broad approach. And the broad approach will never exclude narrow terms, but it will be a bit more sensitive. You may find cases that need a closer look because they may or may not be relevant cases. And it really depends on when, if you ask the question, well, which one do I select? You can select the scope of the search that is most applicable to the question being asked. So for example, if a compound is in early phase development or recently been marketed, maybe it's a good idea to do the broad search because you don't want to miss any relevant cases. Most SMQs have both narrow and broad PTs. There are SMQs that don't have broad, they're just strictly narrow. Like for example, if you think about conjunctival disorders or scleral disorders or lacrimal disorders, the terms in there are really very narrow. But here's an example of narrow versus broad. So lactic acidosis in the narrow scope only has 3 terms. It has the lactic acidosis itself. It will give you a narrow search finding for the 2 terms that really speak to this condition, other than lactic acidosis. But the broad terms are more numerous. And this is just an example of the broad terms. And if you look at these examples of the broad terms, they're not really specific to lactic acidosis. They may convey that there's an issue with acidosis, but not necessarily specifically lactic. So when you're looking up terms, it really depends on your interest. What is it that you're interested in? So if you're interested in specificity, you're going with the narrow search. If you want to maximize sensitivity and you're willing to wade through some cases that may not truly be relevant, then you're using your broad search. Another characteristic is algorithmic SMQs. Algorithmic SMQs really are helpful in types of medical conditions where the broad examples of terms are just all over the place. So the algorithm provides for a combination of terms that when you retrieve them for the same case, then they're more likely to identify a case of interest than using isolated broad search terms. So for an algorithmic SMQ to be successful, it requires you to identify on a patient level or a case ID level. The broad terms of algorithmic SMQs get subdivided into categories that could be groupings, maybe organ specific, signs or symptoms, labs, and so on. So I'll give you an example of an algorithmic SMQ, anaphylactic reactions. So anaphylactic reactions can have narrow terms. So if you say anaphylactic reaction, of course, that's very specific. Even shock is very specific. Circulatory collapse is very specific. But when you think about signs and symptoms of anaphylactic reaction, there could be respiratory signs and symptoms. There could be skin and cutaneous signs and symptoms. There could be cardiovascular signs and symptoms. How would you tell if this is a relevant case or not? If you just cast a broad search, just on its own, a broad search for all of these terms, you might end up with a lot of noise. You might end up with a lot of noise and the need to manually kind of sift through all these cases. What an algorithm does, an algorithm will tell you, well, how many of these broad terms or concepts or events or AEs were reported on the same case. If they were reported on the same case, that's a higher likelihood of being a hit to whatever area of interest that you're looking for. And here's how the algorithm will work. So the algorithm will start always by looking for narrow terms, and that's your group A. So it always looks for narrow terms. If it finds any case in the narrow terms that are very specific, it will tell you here's a hit. If it doesn't find a case in the narrow terms, it will start looking in the broad terms based on your algorithm. So our algorithm for, and let me take you back to the previous slide, our algorithm for anaphylaxis says, if you have a narrow term, that's a hit, or you need a category B, which is a respiratory sign or symptom or manifestation. And in addition to a respiratory symptom, you need one from category C. So for example, angioedema or erythema or one of the other cutaneous or urticaria signs or symptoms. Alternatively, you could either go with B, category B or category C, one of those two, plus a cardiovascular or hypotension syndrome or a symptom or event or AE. So the algorithm walks you through that on its own, and it identifies the cases that meet that algorithm. And if none of them were identified, it will tell you, I didn't find any. So when you run an SMQ using the algorithmic approach, even if you have broad terms in your data that didn't meet the algorithm, it will tell you there were no hits. If you run the same SMQ without specifying it to run as algorithmic, it will find those broad terms. So it really depends on, do you want to sift through a large number of data output and specify the algorithm, or would you rather do the sifting on your own manually? You can do that as well. So the tool allows you to do both approaches. And we'll go through that in the demo. What about hierarchical? So hierarchical SMQs are areas of interest or medical conditions that are so broad, such a broad topic, that it's not really practical to lump all the relevant terms under a single SMQ. So in these type of cases, we create sub-SMQs in a series of queries that are related to one another, but in a hierarchical relationship. So if you run the parent SMQ, you find everything below it. But you can limit yourself to one of these sub-SMQs or subordinate SMQs to be more inclusive. The hierarchy provides flexibility for you as an end user. So here's an example. Let's say that you're interested in cytopenias, low cell counts, hematopoietic cytopenias. Are you interested in all of them or in specific types of cells? Are you interested in red cells, erythropenias, white cells, leukopenias, platelets, thrombocytopenias? Are you interested in all of them? If you want all of them, you can run the parent SMQ, the hematopoietic cytopenias, and you'll get all of them checked in your database. But if you're really only interested in thrombocytopenia, you can restrict your search to be more inclusive of that SMQ and more specific to that SMQ. In terms of status, so when we talk about status, each SMQ, including the terms within it, the PTs and the LLTs, has an assigned status. The status can either be active or inactive. An active SMQ basically means that it's available as part of the browser, it's available as part of the tool, it's maintained by the MSSO with every MedDRA release. So far, we only had one inactive SMQ, that was pregnancy disorders. It got inactive because it was replaced with a more comprehensive SMQ of pregnancy and neonatal disorders. So we didn't just cancel it, we replaced it with a more comprehensive SMQs. Now, PTs and LLTs, if they are made inactive, they remain as part of that SMQ. We don't take them out of that SMQ to allow you to assess legacy data. So if you actually had data in previous versions and you did your analysis on a previous version, and then let's say in a couple of years down the line, one of those PTs was found to have been included in error, or maybe there was improved information out there now that made this PT no longer relevant to this SMQ and it was made inactive. We keep it in that SMQ, we change the status to inactive, and that allows you to compare against legacy data. So you never lose the ability to know, when I ran this last time in that version, that PT was in there. Maybe that's why the results are now different. So when applying an SMQ for data retrieval, a current SMQ, you don't run it against inactive LLTs and PTs, because there's a reason why those LLTs and PTs were made inactive. They're just kept there for legacy purposes. So when we talk about SMQ versioning, it's always recommended, and it's best practices. When you use an SMQ to make an analysis, run an analysis against coded data, the version of that SMQ must be the same version of the coded data. Otherwise, you might be looking for a term that was not coded in that older version. Or maybe you're not looking for a term that you should be looking for because you're using an older SMQ. So mismatches in the version could give you unexpected results. So a very important reminder to please always check what version your data was coded in and what version of SMQ you're using. They have to be the same version to get accurate results. So here's an example. So in version 23, there was a new preferred term that was added to the SMQ in MedDRA that checks for breast cancers, and that PT was the hormone receptor positive breast cancer. If you're using an older version of SMQ, that older version of SMQ from 22.1 and older, they're not going to contain this PT. So if you have that PT coded in your data, you're not looking for it. So you're undercounting your data output results. So it's important that the versions match between your coded data and your SMQ version. Of course, there are benefits to SMQs. You know, they are applied across multiple therapeutic areas. They are standardized. Like we said, they're validated. They're reusable. So using them, you can ensure that your data is reproducible. They are a standardized way to communicate safety information across different products, across different subject populations, across regions, across therapeutic areas, and across time. And their use ensures consistent data retrieval. So they are used by regulators. And their maintenance is part of the responsibility of the MSSO and the JMO. You don't have to worry about maintaining the SMQs because that's done for you. There are limitations to SMQs, so it's not possible to cover every single medical topic of interest by an SMQ. So we said there's 110 level 1 SMQs, but of course there's more than 110 safety questions out there. And SMQs evolve. So SMQs don't stand still. Medical knowledge evolves. MedDRA evolves. MedDRA is a living, breathing database. So we have preferred terms added to MedDRA almost with every release. So we do update SMQs with every release as applicable, and that means that you need to ensure that you use the most recent if your data also is up-versioned. Okay, so I want to show you the browser demo and the SMQ views. So like we said, in the chat feature, you have temporary credentials that will help you click through if you like to do that. You can use your own organization-specific credentials if you prefer that. If you're not sure where your organization-specific credentials are, you can retrieve them via the self-service application. And here's a quick link to our web-based browsers. So right now we have, I'm going to show you both hopefully. So we have the existing web-based browser that you can access with a quick link and just log in. And of course, your login page allows you to change your interface language. So you can change your interface language. It defaults you to our system organ class view. So this is our SOC view. And if I want to see my SMQ view, I can just pull it up from here. But just to show you what you see in this defaulted view are your system organ classes. So here's your 27 system organ classes on your left-hand side of the screen. In the middle is your search box. And if I put, I guess, autoimmune, if I put autoimmune and just hit search, it gives me the total of the terms it found at whatever hierarchy. So if it found it at the LLT, at the PT, HLT, HLGT, and these are very interesting hierarchies if you want to leverage the aggregation levels in MedDRA, the grouping levels in MedDRA, to find out if there's an area of interest that's specific to your medical condition. Now, if I can also limit which system organ class I'm looking in. So if I have a specific autoimmune under, I don't know, let's say cardiac, and I search, that I'm only looking for autoimmune conditions relevant to the cardiac disorder. So I can do all of that. Let me clear the selection. If I switch my view to SMQs, I no longer see the 27 system organ classes. I see the 110 SMQs on the left-hand side of the page. As you scroll down, I can still put in a search word and assess it. So I can look up autoimmune and do search. Okay, and it will default to show me which SMQs it found that had the word autoimmune in it. So this is really very helpful. It still shows me PTs and LLTs, but less than before. And the reason for that is, and let me take you back to before, just so we see the difference in numbers. So in the SMQ view, it found 109 LLTs, 47 PTs. In the SMQ view, it found a few less, 102, 46. And the reason for that is when you are in the SMQ view, if you want to look up a PT or LLT, it will only show you PTs or LLTs that already exist in SMQs. So it will only tell you, I found these PTs or LLTs only if they are already existing PTs or LLTs in current SMQs. Now, this is not the only browser we have. I want to show you the same view, but let me take you back to our MedDRA website and go under How to Use and under Tools and under Browsers. Here on the right-hand side, you have another way to open the current web-based browser, but right below it, you are able to open the new web-based browser. So we do have a new web-based browser, and just to give you a quick look as to what it looks like, let me default the settings back to restore default. This is what it looks like. It's a much more simplified view or landing page of the browser. So you don't see all the clutter that you see in the current web-based browser. It has all the same features. It has all the same abilities to customize your view. It has all the same tools, but it's a much simplified interface. So it takes you straight to the search box right here. And if I do autoimmune, I still see the LLTs, the PTs, the grouping terms, HLTs and HLGTs. And here is my option to switch to my SMQ view. I still see the 110 SMQs, and I can still repeat my search again with the autoimmune and find the SMQ that has that word in it. So if I want to go deeper into my SMQ, I can right click on my SMQ, and I have a couple of options here. I can open details and occurrences. So what I did is just right click on the SMQ name. And if I click open details and occurrences, I have a nice snippet that you also find in that introductory guide to SMQs. I have the description of the SMQ, a note about the source about the SMQ. I may have additional notes here. It's not as detailed as the section for that SMQ in my introductory guide to SMQ document, but it's really helpful. I can get an idea of what this SMQ is intended to do. There's another thing I can do with the right click. Okay, let me just close this. With the right click, I can go to browser. And if I go to browser, basically what I'm telling the tool to do right now, the browser to do, is take me to this SMQ from the left-hand side without me having to kind of filter through or scroll down and find it. They are alphabetized, I see that, but I just want a quicker way to get there. And it takes me to that SMQ and it defaults it open. So I start to see the preferred terms that are included in this SMQ. And I see that the first group is blue. The first group are my narrow terms. And if I scroll down and I scroll down even more, this is a large SMQ. I can see there's a lot of information in here. So I keep scrolling down. Now I see red. And once I reach red, these are my broad terms. So there's my narrow on the top and my broad on the bottom. And this is my legend. So if I go to the hamburger menu on the left and click legend, I can see the explanation of the blue PTs are the narrow and they're active. The red PTs are the broad and they're active. And if I see them in boxes, that means that they have been made inactive. So that's kind of a quick summary of this. There's another neat feature about the browser that will help you. Now, let's say I'm interested in this SMQ, but I want to share the PTs in it. I want to share them with my medical review team, and I want to see if they're happy with these PTs, that they want to adopt this as a standardized search in our database. Rather than have them sit next to me and scroll through, I can just right-click on the SMQ in this panel, and I can export it. If I click SMQ export, it's going to ask me, well, you want this in English, right? Because that's what we're seeing. You want this in this version, right? Because that's what we're seeing. Here's the unique numeric code for this particular SMQ. Here's the name. Do you want any inactive PTs? I'm going to say no for now, and I'm going to export it. And it's going to right away open it up, and let me show you what it looks like. So here's my SMQ. I can save this file to my files. I can rename it. I can edit it. I can share it. I can add notes to it. Basically, this is mine now. So it gives you a few details. It tells you again that it provided this SMQ in version 28 because, like we said, the version is very important to document. So it reminds you that this was version 28 in English, gives you the date and time, and it tells you that for this particular export, you did not want the inactive PTs. Of course, we don't want the inactive PTs to be included in our search. So you don't want to share inactive PTs with your programmer. You can retrieve the inactive PTs if you're interested in comparison against legacy data or older version data. But if you're sending it to your programmer to create an SMQ in your data, you don't want to send them inactive PTs. And then it lists them. So I see them first with the narrow, alphabetized, and then on the bottom, I'm going to see the broad. There's my broad, also alphabetized. And if you want that level detail of which MedDRA version this particular PT was added and when it was last modified, you have that ability. So this is really neat. It also gives you the numeric code of that PT if it's easier for the programming team. So this is a nice feature. All right, so let's go move on to the next slide. Let's talk a little bit about, well, we talked about a tool that we can run the SMQs via the tool in the browser. And yes, that's correct. There are 3 different browsers offered by the MSSO. You have a desktop browser, the MDB. Basically, the MDB is a browser that you can download to your laptop, to your computer, and you can use it offline. It has all the functionalities of the web-based browser, but it comes empty. It doesn't have the MedDRA files in it. So if you want to use the desktop browser because it makes it easier for you to work offline, yes, you can do that. But please remember to also download and upload to the desktop browser whichever MedDRA files you're interested in at whatever version and whatever language. And of course, every time we release new MedDRA versions, you do need to grab them and upload them to your desktop browser. The web-based browser, like we said, there's the existing one, which is now the legacy web-based browser, and there's a new one, which is the new web-based browser. You have the links online, and eventually we're going to be retiring the legacy web-based browser, and then you have a mobile browser. The mobile browser is a URL. It's not an app, but it's designed with a larger interface to be used in your smartphone or tablet. The browsers all require your ID, your MedDRA ID and password. They allow you to view MedDRA terms and search MedDRA terms, and the same with SMQs. They support all MedDRA supported languages. You can change your interface language to the one you're interested in. And the desktop browser and the web-based browser allow you to export your search results and use your research bin. And this is something that we talk about in that other webinar, the data retrieval and query building. We do a demo on the research bin uses. The special features of the desktop browser and the web-based browser is that you view both primary and secondary hierarchies, secondary link informations, and you can upload your own data into these browsers and run them against the tools. So there's hierarchy tool and there's the SMQ tool. You can use the Boolean search options. You can specify, I'm interested in a search term that begins with a certain word, excludes a certain word. You can use the not or search options. And for the supplemental changes, these are only available on the web-based browser. Supplemental changes basically are new changes, new terms. They're going to be added to MedDRA. They're not yet released. They have gone through the review process. They have been approved by the international medical officers. They will be part of the next release of MedDRA, but you can still see them now in the web-based browser. So how do you run these SMQs? So just like we said, SMQs are basically stored queries. So you have a defined list of terms that you're looking for in your database. And like we said, most organizations do their coding at the LLT level, and typically their data storage at the LLT level. When we provide the MedDRA files with every MedDRA release, we do provide you with ASCII files that include all the PTs as well as the subsumed LLTs in all of the SMQs. You are able to load the SMQs into your own configured query tool and then run them against your database of coded MedDRA terms to find hits. Whether you can create the algorithms may or may not apply in all organizations. So that's a question for your IT team or your database team. But you can run them in all of their different types, narrow, broad, algorithmic, and hierarchical, using the SMQ analysis tool in your browser. So I'm going to do a demo now, but before we do the demo, maybe I can stop here since we're at the hour and ask, Hannah, do we have any questions at this point?
Yes, we've got one question asking, why is there a difference in the number of PTs and LLTs when you search in Spanish versus English?
In PTs and LLTs, so if you're inputting, and let me just go back to the one of the browsers. Let's do just to show you the different languages. So when you open up the browser, it defaults to English, and, unless, of course, you change the settings at your end, and you can select more than one language. So if you keep it to show you more than one language, so you said Spanish, I can pull up Spanish, and I can keep English. Once I selected Spanish, if you noticed on the left-hand side here, I still see the system organ classes in English, and I see the Spanish below it. Now, if I put, and I'm looking up in English, autoimmune, and I hit enter, there's no difference, right? Because it's showing me all the terms in English that have that word, autoimmune, and then all the terms in Spanish below it that have that word of translated to the Spanish language. Now, in Spanish, it's not autoimmune, right? It's not the same order of letters. So it's not looking for that order of letters for Spanish. But if I change the language that I'm searching in, I can change the language I'm searching in to Spanish. If I keep it autoimmune and search, it's not finding anything because that specific order of letters does not exist in Spanish. If I do auto, that might be a different output, because it will look for that particular order of words. So if I put in the root of a word, it will look for that letter connected to that other letter, and so on. So it's going to look for anything with these letters following each other. If I put a full word, it's going to look for that word. It's also going to use synonyms. So if I take you back to English, and for example, if I put heart and I hit enter, there's a large number of outputs, but not all of it has heart. Some of it has cardiac, right? So depending on the synonym for that particular language, if I'm choosing English and English has a synonym of heart is the same as cardiac, that's the synonym list here. It's looking for both of them. The Spanish synonym list may be different. So it really depends on how you did your search and what was the root that you used or the specific letter that you used. But if you're interested in seeing them in more than one language, I would advise that you keep the English and add whatever languages you want. Did that answer your question? If not, please come back to us.
They came back and said, if I search autoimmune in English versus autoimmune in Spanish.
So, okay, so that's a good question as well, because sometimes in translations, you might have certain translations that end up with an identical word in Spanish, but it's two different words in English. So let me give you an example. Let's do anemia. So anemia in has two ways of spelling in English. So we have anemia with an E, which is the American spelling, and we have anemia with an AE, which is the British spelling. But in Spanish, there's no difference between that American spelling versus that English spelling. So you see it as the same word. So if you're looking up anemia in Spanish, you're probably not going to get multiple hits of that one. And I hope I answered that question. But if you're noticing something that's missing and it should be there and there's a technical issue, please feel free to submit a comment to our help desk and we'll have our Spanish team take a look at it in more detail. Okay, so let me go back. Did that answer the question, or is there any other questions?
It looks like that answered it. There's no more questions.
Thanks, Hannah. All right, so this is the fun part for me. I enjoy the SMQs. I think they're a lot of fun, and I think some folks get a bit nervous when they talk about SMQs, but once you really start experimenting with them, they become really a lot of fun, and they show you a lot of information. And I hope this next demo helps illustrate that. So here's a practical question. So let's say I'm starting new. I'm new to this SMQs. I'm keen to learn, and I just received my first output of my adverse events on my studies, and I want to show you what that this particular output looks like, because it's really a simple output. I'm going to show you what kind of Excel sheet we're talking about when we run analysis with the SMQs. So all of our tools that are in the browser, they don't look for complicated information from you. They're actually designed to make it as easy as possible for people to use them. So all they ask for you for SMQs are 4 columns. That's it. If your output has even more than that, that's fine. The tool will only look at the first 4 columns, but it asks you to please keep them in this order. So the first order, the first column in order is the row ID, and it's optional. So if you don't use row IDs, you don't really have to use this column. You don't have to fill it, but you have to keep it. You have to keep it as the first column, because the tool will be looking at row ID in the first column. It will be looking for the MedDRA coded term in the second column, whether this is the preferred term or the LLT. And if you're looking at a data output and you don't even know, am I looking at LLTs or PTs, that's fine. The tool will work. It's not a big deal. And it will look for the numeric code in the third column. Now, if you're analyzing data that is in MedDRA English, it's English data, either one of these will be sufficient, because we don't have duplicates in English anyway as terminologies. If you're using Spanish or any other language, then please include the code. The code is very important to include, because just like we showed that anemia with an E and anemia with an AE, they are the same term in Spanish. But let me show you something. Let me go back here and show you the codes and search again. Now you notice that the codes are not the same. So the term on top for anemia with an E in English has a code that ends with a 272. The anemia with an AE for the British English has a code that ends with a 034. The code is the same regardless of the language. That's very important in MedDRA, because that's how we communicate across different languages. The numeric code is unique regardless of the language. So you see, the Spanish translation was the same in both of them, but the code is not. So if you're analyzing your data and you're running these SMQs in English, the anemia with an E and anemia with an AE are different. That's fine. You don't need the code to differentiate them. The tool will know what you're talking about. But if you are running in Spanish, for example, and you put anemia with an E, then the tool is not sure, are you talking about 272 or are you talking about 034? So if you're running analysis in a language other than English, that's when you need to include the code for sure. But in English, either one of these two is enough as long as you keep the column. So like we said, the columns need to be maintained. They could be optional for row ID, and it's also optional for case ID. So what's the difference? Case ID is subject specific. And folks on the line who are data analysts will know that sometimes you have row IDs that are different than case IDs, and this is alphanumeric. If you're wondering about what the tool will accept, it will accept alphanumeric row IDs. Case IDs are subject specific, and case IDs are, I recommend you use them in all SMQs. They are required for algorithmic SMQs because algorithmic SMQs are looking for certain types of events or AEs in the same subject, in the same case. So they will be looking specifically for case IDs. That's required for algorithmic SMQ output to be correct. But if you're running other SMQs, the whole point of SMQs is case identification. Why wouldn't you include your case ID? It'll help you identify your cases. So I do recommend that you include them regardless of which SMQ you're using. All right, so let me go back to the slide. So this is the data. So it's basically 33 rows. I have some patients with more than one adverse event. That's fine. So I have the same ID repeating, which is expected. The same patient had more than one adverse event. I have them coded, whether it's the LLT level or the PT level, the tool will work. That's fine. And I included the code. So I have information in all 4 columns. Now, here's the fun part. I'm going to run this SMQ. And because it's the same thing, whether we run it in the new browser or the legacy browser, both browsers have the tool. I'm going to run it in the new browser. But just to show you where the tool is in the legacy browser. So when you access the legacy browser, across the top, you have this huge banner across the top for your settings and for your tools. And here on the right-hand side of the banner, you're going to see the tools that we have. There's your SMQ analysis tool. And right next to it is your hierarchy analysis tool. So your SMQ analysis tool will default to the English language. There's your version, the most recent, and it will default to narrow. The tool always defaults to narrow. That's the most specific. You can change it. So you can change it to broad. You can change it to algorithmic. Well, you can ask me now, well, what about that hierarchical SMQ that you talked about? How come it's not on this pull-down list? Well, here's the hierarchical selections. The tool will default to all SMQs being run. But I can tell the tool, no, I'm only interested in this one. And then, like it says here, if you hit the control key, you can also select this one and maybe also this one. So I can tell the tool which ones I want. And the ones that have pluses next to them, they are hierarchical SMQs. If I want all of my biliary disorders, I can include them in my SMQs. If I don't want all my biliary, so I'm looking at them and I say, okay, I'm interested in my infectious biliary disorder, I can select only that as part of the group of SMQs I want. Or I can clear my selection and say, let's run against all of them. And you'll notice that some of them will tell you, I'm running an algorithm. I'm running an algorithm. So we have 10 SMQs in our arsenal that have algorithms that are built in. Now, I want to show you the same tool, but with a minor difference between the new browser and the existing legacy browser. The same columns. So like we said, the row ID, optional data, the LLT or PT, the code, and the tool will walk you through. If you're English, either one will be fine. If you're a language other than English, then please use the codes or both of them. And then your case ID is optional. Unless you're doing algorithmic, then it becomes required. But like I said, I do recommend you keep your case ID regardless of which SMQ you're running. And it will tell you here something else. It will tell you that please make sure that the versions match. like we said, if you're comparing data that's coded to a MedDRA version with an SMQ against an SMQ that is of a different version, you're not going to get a consistent, reproducible outcome. It has to be the same versions. So please be careful when you run this tool that you know which version of MedDRA your data is coded in before you run the tool. And you can always change the version here. You can always go back and change whichever version is applicable. Another thing the tool will tell you, we will never store your data. We never store it. So if you upload data in here and you're worried about what happens to it, it never gets stored. In fact, if you run the tool and you don't export your results, then you have to run it again. We don't save the data. And it tells you here that the maximum number is 100,000. That's the legacy browser. And then it tells you that, of course, we're assuming what you're loading is MedDRA data, not natural verbatims, not your source verbatims. You have to load MedDRA data for the tool to work. So how does the tool look like in the other browser? So let me pull up the other browser. Oh, here we go. In the other browser, it's an easier approach because you have this tool symbol here on the top. And if you click it, it's going to give you all the tools together. I don't know if you noticed, MVAT, the MedDRA version analysis tool, it's not offered as part of the legacy browser. It's a separate tool right now. So this is cool. It's a really nice feature in the new web-based browser that MVAT is embedded in the new web-based browser. And here's my MVAT data impact that we said you can import your data. Unfortunately, we're not doing the demo for that today. Here's my hierarchy analysis. That's also another tool that we present in other webinars, so we don't do it today. And here's my SMQ analysis. So it's the same thing. It's defaults to, here's my default is English, the most recent, and narrow. And here are my hierarchical. So I can pick the ones I want. And the ones that are hierarchical, I can expand and find the one I'm interested in. And I can pick as many as I like, or I can clear my selection and let it run against the whole 110 SMQs in all their levels. But when I look at my import data, same thing again. It tells you the four columns, just like before. There's no differences here. It reminds you that the specific format of data that it will accept, for in Excel. It will tell you that the version and the language, just as a reminder, if you're running it in Japanese, if you're running it in Chinese, if you're in any language, just match what you have in your coded data files. And it tells you again, we're not going to save it. Your data will be erased. And of course, that you're loading MedDRA data. There's no limitation anymore. There's no limitation on 100,000 rows. So even though that was a generous allocation, there's no limitation anymore. So how do we run these? I'm just going to go back to my Excel sheet. Just as a reminder, I have about 33 rows. So I have 33 events and I have 17 subjects. I have 17 patients. I'm going to close this and run the tool. So here I'm at the part where I'm going to import my data. So I'm at my import data tab and I'm going to choose my file. So I'm going to click and choose my file and I have it under my demo. So it's my SMQ analysis exercise. And right away I have my first output. Now I let it be as it defaulted. So let's open up and see what it looks like. And again, I can save it, I can share it, I can rename it, I can add my notes to it. I mean, it's my tracker now. It will remind me on the top that you're running an SMQ analysis on such and such a date. It will remind me that you used English version 28 and that you are using the narrow search. And it will remind me that you opted to select all SMQs. So just as a quick look, I have 47 rows. Okay. So what information am I getting? It's gonna repeat my first 3 columns back to me. It's going to tell me, here are your row IDs. I'm using your row ID information. Here are your terms, and here are the codes. And of course, if I make a mistake and I attach the wrong code to the wrong LLT, it's going to tell me I wasn't able to verify this particular row. So if you enter incorrect information, it will tell you. It will assess or review or run against correct rows. But if there are any rows with errors in them or misspellings or things like that, it will point them out to you. And just in case I inputted LLTs, it's going to show me the preferred term level. And you're going to see some columns are hidden. So if you unhide, it's giving me the SMQ code. So sometimes it has an SMQ code and sometimes it does not, but let me go back and hide this. And this is the most important column in my output. My most important column, because it's telling me what are the SMQs it matched against. So it ran the report against a narrow search. And a reminder, narrow search means I'm being very specific. I don't want to be sensitive. I'm being very specific. I just want the terms in that SMQ that are in the narrow scope to be identified if any of them exist in my database. So in my list of 33 AEs, how many of them hit on which SMQs? If you'll notice the order, it defaults to numeric order based on row ID, but I don't like seeing it that way. What I'm interested in is the SMQs. I want to see if there's a signal. So I can do Control-Shift-End. I can do it this way, and I can just sort, and I can choose to sort by the SMQ matched. Now it's more interesting. Now I can see, for example, let's say I'm interested in pancreatitis, in acute pancreatitis. I have one case of acute pancreatitis on subject 9. And it will tell me this is narrow, of course, because that's my limitation. I told it to run against narrow. The category is always A for narrow. So if I'm not seeing any other alphabets here, that's also kind of a hint that I'm only running this against a narrow search. The weight is something interesting. We're going to talk about this when I show you the algorithmic output. There's a weighted approach for only one SMQ, and that's SLE, systemic lupus erythematosus. That's such a complicated medical condition with so many different manifestations that it has its own unique approach as an algorithmic SMQ with a weighted analysis, with a weighted approach. It will also tell me if it found any of my PTs that are in my database in that SMQ as active or as inactive. If there is an algorithm to this particular SMQ, it will tell me that here's the algorithm, here's a different algorithm, here's a third algorithm. So these are the algorithmic SMQs that hit against my data. And here are my case IDs. And then if it did identify algorithmic SMQs, it's going to give me the details on the last few columns. So level 1 SMQs are my 110 main types of medical conditions that I'm looking for. Some of them are kind of larger type of conditions that need to be broken down into sub SMQs. And if it matches against these sub SMQs, it will show me to which level it matched. So this is also a neat feature. It will hit on the hierarchical output. Okay, so I only have one case of acute pancreatitis. What about, do I have any cases, for example, of SLE? I'm looking through and scrolling down, and here's my SLE. I have one case of SLE, subject 13. So let's say I'm interested in these two. I'm interested in acute pancreatitis, and I'm interested in SLE. And when I ran it under narrow, I only found one patient each. What happens if I run it against broad? So let me go back to the tool. And here's my settings. My first run was to leave it narrow. Now I'm going to do the broad. I'm going to do again. I'm going to choose the same file. And I'm going to wait for the outputs, and here it is in my downloads. Okay, and scrolling down, I see a lot more rows, which makes sense because now I'm being more sensitive. I'm casting a wider net. I'm willing to sift through the cases. I don't want to miss anything. So let's do the same thing. Let's Control Shift End, and let's sort and sort by which SMQs were matched. This column B tends to be a bit too wide, so I like to make it smaller. Okay, now let's look. Look at this acute pancreatitis. In my narrow search, I only saw one row. Now I see 4 rows. I see 3 subjects. What's going on here? Why am I seeing them? Well, 3 of them matched against broad scoped terms. So what kind of broad scoped terms? So the one that's acute, that's narrow, matched against an adverse event that said pancreatitis acute. But this subject 7, had abdominal pain. That was the only sign or symptom. And you see the category now changed based on the algorithm. But subject 1 is interesting because subject 1 had 2 adverse events. One of them is abdominal distension, and one of them is amylase abnormal. So, okay, this is a short output. It's not too bad. I can pull up all 3 subjects and I can send all 3 to my medical monitor or my safety physician. But what happens if I have hundreds of them? What happens if I have even more than that? What if it's a larger database? So also let's take a look at the SLE. So I'm just scrolling down to see SLE. And of course I can filter, so I can just filter rather than scroll and pull up the SLE in my filter. So there's my SLE. Now in my narrow run, in my narrow search, I only had 1 subject. Now I'm looking at 3 subjects. So again, only one of them is narrow and the rest are broad. But look at this. I see information in column I. I see numbers now in column I. Where did these come from? So let me take you back to that document of how to use support documentation, introductory guide to SMQs. And let's look at this SLE. What's going on with the SLE? So here's my systemic lupus erythematosus. Here's my definition. Yes, it has a wide range of clinical presentations. Here's my inclusion, exclusion, and then here's my algorithm. That is a wide range of possible clinical manifestations. The narrow terms are always category A, we said. The other terms have different category alphabets. So the subjects may have photosensitivity manifestations, oral ulcers, arthritis, serositis, events related to renal disorders or neurologic disorders or hematologic or immunologic disorders. So it has a wide range of manifestations. If I'm looking specifically for SLE, it's hard to tell which are the most important ones. So when this was created, the panel of experts that worked on this decided to introduce a weighted approach to give a numeric value based on the type of category that these broad events come from. And for example, they said the least significant categories are the photosensitivity and the renal disorder in this particular condition for SLE. But the ones that have 3, they are the most significant. But we'll only give them a maximum of a numeric value or a numeric weight of 3. What constitutes a SLE signal is if you have events reported on the same case or the same subject where the total of the numeric weight is 7 or higher. That will constitute a case of SLE. And that's how the algorithm, the built-in algorithm in the tool will do. So going back to my output, this was my narrow search. I was looking at my broad search. This was my broad search. Here's my SLE. I have the numbers. I can add them up manually, filter by the same case ID and add them up manually, but I can also run it algorithmic. So let me go back to the tool. Here's the tool. I'm going to go back to my settings, and this time I'm going to choose algorithmic search. And let's see what happens when I choose algorithmic search. Again, same source data. I'm not going to change my source data because I want to see the differences as they come out. This is a much shorter output, much shorter output. Again, because we only have 10 algorithmic SMQs, it's not necessarily going to find terms in your database against all 10. It will output whatever it found on an algorithmic approach. So if I just data filter and I'm looking for first acute pancreatitis, I see 2 subjects. There was 1 in narrow, 3 in broad, and now 2 in algorithmic. Why is that? Because the algorithmic approach said I'm only looking up for events that match the narrow scope. So this is pancreatitis acute, which is a narrow scope. Or if I have a patient and on that same patient, I can recognize that that patient met the criteria. So it identified that case 1 met the algorithm for this particular SMQ because that patient, the same patient, had abdominal distension as well as a malaise abnormal. I no longer see the patient with the abdominal pain. That's just a broad hit. It may be too much noise. Maybe that's a discussion with the medical monitor team, depending on the size of your data, how much you know your data, whether you already have a safety profile of your data or not. But this is really interesting. Now, you'll notice that the algorithm does not take into consideration temporal association. So yes, the same subject had these 2 events, abdominal distension and amylase abnormal, but we don't know if they occurred at a time interval that's close to each other, within a few hours, a few days, maybe even a few years apart. If it's a few years apart, that's not relevant. So you can extrapolate your own analysis. You can leverage the starting point of this SMQ, and you can add more details. You can merge with any data files that you have, and then talk to your programmers about how can we introduce yet another layer of adding even more specificity and polishing up my outcome if I have a huge number of database or a huge number of AEs I'm sorting through. Yes, you can do that. You can leverage the tool and you can add more details to it on your end. You can also, I'm sure many of you in the data analysis field maybe thinking about different ways to maximize the data output. You can think about, for example, introducing cohorts based on exposures, based on dosage, based on patient population, based on genders, based on age populations. So you can do all of that, but you can still leverage the tool. The tool is easy, it's available, it doesn't require any programming knowledge, it doesn't require MedDRA knowledge. It's really a nice tool to have. It already has the built-in algorithms. Okay, so going back to the slides, this is what we did. We applied the SMQ to our coded data. This is a screenshot of what the tool looks like in placement in the new web-based browser, and we searched through the different options. And of course, the tool is the same tool that's available in the legacy web-based browser. It allows you to do the same kind of output. We ran the broad search on all SMQs. We saw how sensitive that was. We saw that the result included not just the broad terms, but also the narrow search. And also we found the hierarchical. So going back to, here's my broad. I don't want to filter anymore, but just to show you the hierarchical, as you scroll through the broad, I'm sure you're going to see more outputs just because it's a more sensitive approach. Here's more levels of SMQs that I'm seeing. Look at this one. It's all the way down to, which one was it? SMQ level 4. So if I allow it to look through all of my hierarchical SMQs, it will drill down to even the level 5. It will tell me I found this at level 3 or level 4 or level 5. So it does that. And of course, we ran it under algorithmic. And with algorithmic was a very limited output because it excluded subjects that did not meet the algorithm. So if you're sifting through a large database and you're interested in honing in on these algorithmic outputs, you can activate that algorithmic approach within the tool. If you don't want to do that and just run through narrow and broad, you can do that. It still gives you the output. Before we move on to SMQ applications, Hannah, any questions at this point?
We've just got one question asking, do regulators use SMQs?
Yes, so SMQs are standardized MedDRA queries. They are an easy way to compare different manufacturers of the same product. They are an easy way to identify and assess risk-benefit analysis across the board in different regions. And maybe I can give you, let me go back to our website. So this is our website. I want to give you a nice place that you can start looking at real life applications of SMQs. So under how to use and tools, because SMQs are MedDRA tools, you see a click for SMQs. You can take a look at SMQ basics, just like we said now. And here are some SMQ case studies. If you click on SMQ case studies, it will give you real life examples of applications of SMQs as tools for safety signal detection, and some of them speak to the specific database that they were run against. So for example, this one talks about user vigilance. This one talks about FDA and how they assessed these SMQs. And I'll tell you something else about SMQs. I do recommend that you analyze your data in SMQs because there could be information in there that you haven't found if you don't run the SMQs that a regulator might find, because regulators do run SMQs. And maybe you want to be ahead of that in case you're getting any queries from regulators. So thank you for that question. Any other questions?
That is it for the moment.
Thanks, Hannah. All right, so SMQ applications. SMQs are a tool that is highly useful for assessing safety profiles in clinical trials. Now, of course, whether you want to apply them across all the list of SMQs really depends on where you are. If your safety profile is not fully established, you're still getting to know your product, then it's a good recommendation to apply the SMQs, all of them, on a routine basis as a screening tool. Once you are at a stage where you have an identified issue, for example, you have preclinical data that guides you to a certain area of interest, or you're using a product with a known class effect, you can hone in your search by selecting specific SMQs that target that particular class effect or safety question as identified in your preclinical data. In post-marketing, SMQs are a very useful tool for data retrieval and analysis when you have a suspected or known safety issue, and you can apply it the same way. You can do multiple SMQs as signal detection, or you can do safety analysis on targeted SMQs. You can even use these for single case alerts, depending on if your database can be programmed to issue alerts on a case-by-case individual basis. You can export that SMQ like we showed you how. Please don't include inactive PTs because you don't want to be looking for inactive PTs. And send that list to your programmer and tell your programmer, if I receive a case in my safety database that gets coded to one of these PTs or LLTs, and it's up to you to decide, you can use only the narrow or you can use the broad and narrow. And you can tell the programmer, I want a case alert to notify me right away because I want early notification if that happens. So that's single case alerts that the SMQs can be used for. And of course, periodic reporting. So safety aggregation, safety analysis on a aggregate approach for even for lack of efficacy. So the uses for the SMQs are not just in clinical trials, but also post-marketing. And we're going to show you two scenarios where hopefully the application of SMQs brings the point home. So you started in a company, and you're assigned risk-based risk benefit periodic evaluation. So it's part of your assignments. It's part of your tasks. And you attended a webinar like this, and now you're excited about using SMQs. And your company has been on the path of development for a new drug, and the new drug is for onychomycosis. The projection is that this will be an 8-year project and a total cost of $1.2 billion. So a lot of money involved here. And for folks who are doing benefit risk assessment, or risk benefit assessment, I should say, the first question is, well, what are you trying to cure? You're trying to cure toenail fungus. So that's onychomycosis. All right, so you learned about SMQs and you started applying them as part of safety surveillance. And you decide you're going to periodically run the SMQs on a regular basis against your serious adverse events, right, in your database. And once you hit 1,000 patient exposures, you identify that I have 5 possible cases of hemolytic anemia. So hemolytic anemia is not an easy risk to accept. I mean, it has numerous consequences. It could be just general symptoms, but it could be life-threatening. It could require some serious intervention, starting from blood transfusion all the way to even splenectomy. So it's not an easy risk to accept. And remember, you're trying to cure toenail fungus. So is that an acceptable risk? And you're going to submit your recommendation to your team that no, this is not a favorable risk at all. I mean, this is a serious risk. And if the treatment potential is for a minor condition like that, it's a hard recommendation to present. But your recommendation is to pull the plug on this project. If your team repeats the analysis after you, they're going to be able to reproduce it with the SMQs. They're going to find the same things you found. And it's really a valid recommendation. It actually saves money. It actually saves time. And most importantly, it saves patients' lives. So job well done. Here's a second scenario. This time you're working on, it's not a new product, it's actually a drug that is the 4th in a therapeutic class. And you already know that the other products in this particular class have been associated with the same kind of safety profile. You're seeing high blood pressure, you're seeing angioedema, but you're trying to cure something significant. Let's say you're trying to cure cancer. And with the seriousness of the target disease, you think that high blood pressure and angioedema are acceptable risks. And you learned about SMQs, so you start running them. And you start with the early development and you run them. And you keep running them. Even in your early post-marketing data, you keep running them. And you're checking specifically for the SMQ for hypertension and the SMQ against angioedema, the more data you're getting in. But here's an interesting thing that's happening. You keep running these SMQs, but you're not getting hits. You are not getting hits. What does that mean? Well, I think that means that you're finding a better, safer alternative. So even when the SMQs don't find hits, that can be a highly relevant and welcome news, because in this case, your marketing team is going to take you out to a really big dinner. This is really good news. So these show the applicability of SMQs in real life and the importance of running them and why they are being used by regulators. What about customized searches? So one of the things that we always recommend is don't change the SMQs. If you change SMQs, they are no longer a standardized way of running queries. However, there could be compelling reasons why an SMQ will be modified by your particular organization. And so, for example, you're running an SMQ and one of the PTs in it is always giving you a large number of irrelevant cases, just too much noise. And you found that removing that PT was actually helpful. Well, that could be a compelling reason. But in this case, you can't say that you used a standardized SMQs. You're using a modified MedDRA query based on an SMQ, and you need to document exactly what you did, at which version you did it, and how you're going to be proceeding in the future. Are you going to always be removing that PT in future versions or not? Are you going to be using the next release of that SMQ and then omitting that PT? Or how are you going to be able to maintain the next versions of the SMQs? Now, one interesting SMQ is lack of efficacy or lack of effect. That particular SMQ is actually commonly modified. And let me show you what that SMQ looks like. So here I am in my browser. Um, any of my browsers, there's my lack of efficacy, lack of effect. You're going to see terms in there that are device specific, terms that are drug specific, terms that just say therapeutic product, terms that are vaccination specific. So depending on what your product is, maybe you don't need all of these product specific terms in that SMQ. Another thing that this SMQ will need customization on is what is it that you're looking for that is not working. So for example, if you're assessing maybe a device, maybe an intrauterine device that will prevent pregnancy, maybe you're assessing that kind of device. Well, if the device is not working, then shouldn't you also include terms in here that capture pregnancy? So for lack of efficacy and lack of effect, this is one SMQ that is commonly and even it's recommended to be modified, but please don't forget to include all the documentation that we talked about. You know, what you did, how you added it, and how you're going to be maintaining it. Customized searches ad hoc, like you creating your own query, is another way to use MedDRA and leverage MedDRA. But this is not a topic that we can go into too many details now. We did cover it in that data analysis and query building webinar. For creating customized searches, you do need medical background because you got to start with what defines your area of interest. That will lead you to which PTs or LLTs in the MedDRA hierarchy fit those inclusion and exclusion criteria from which system organ classes. So now you're starting to think, I'm going to expand the team now. Yes, I need my physicians who understand the condition, who will help me assess inclusion exclusion. I need my coders. I need my folks who understand the structure and build of MedDRA to help guide me which system organ classes am I looking in and how not to forget uniaxial system organ classes or general SOCs that may have terms in there that are, for example, fatal terms that may be relevant to me. One point to remember, always reference the ICH endorsed guide for data retrieval and presentation. This will have really helpful tips and recommendations and principles on query construction. If you do create a customized search, it's really important to save it and document how it was built, which version it was built against, what terms were excluded and why, and how you're planning on maintaining it. When you document all this level detail, it will help you, for example, ensure consistent use across your different teams. It will help you onboard new people. It will help you address questions from regulators or other stakeholders if they have questions about it. It will maintain or ensure the continuity of knowledge if some of the key players may be changed teams or changed organizations. And of course, if you find yourself needing to create more and more customized searches because an SMQ does not exist for that particular topic, please consider submitting a request to the MSSO to create an SMQ for that particular topic because all of these requests are considered by the SMQ But I do want to show you one thing on our website. If we go back to our website and we said under that, how to use tools, we went into the SMQ. Let me just walk you through it again. So we went to tools, we went into the SMQs, and we said that, there's basic information on the SMQs, but there's also something called an SMQ matrix. The SMQ matrix is available on the website for everybody to have access to. It tells you which SMQs were placed into productions. It also tells you about which SMQs were rejected. So if you're thinking about an SMQ and you're wondering, has this topic ever been proposed before? And if so, maybe you'll get a kind of a quick idea about if it was rejected, why was it rejected, and is it worth requesting it again, or maybe this explanation was enough that you don't want to pursue it. So there's a lot of information out there. Another thing I like here is the SMQ status, because sometimes you want to have a discussion with your safety team or your medical monitoring team about starting the use of SMQs, and they will ask you, well, what are the topics? You can for certainly pull up that SMQ introductory guide and share that with them, or you can do a quick print out of this list. It has all the 110 SMQs as of March 1st. So you'll have an easier way to share that information with them and see if they are interested in any particular areas or medical conditions on the list. And I think that was my last slide. Yes, so we went over the PTC guidelines today. We discussed characteristics, applications, benefits of SMQs and how they can be customized. And of course, we do have these contact information for you on the slides. If you're interested to send an email question to our help desk or access our FAQs or download our desktop browser, you have the link there. And of course, if you want to submit a change request to the MSSO or access the training schedule for future webinars. Hannah, I'm going to open it up at this point for Q&A.
Perfect. I'm seeing just one question, and it asks if changes to SMQs are processed the same way that you can request LLT changes.
Yes, very good question. So let me show you. So here's our website, and there's a couple of ways to access the change request process. So you have a link right here for web CR, which is web change requests. And under how to use, under how to use, there's an option for change requests. So either one will get you to the tool. And when you access the change request, you have the option to specify what kind of change request you're considering on the top here. So you have term changes, like when you're requesting changes to the LLTs or PTs, and here's your SMQ changes. So depending on what you had in mind, did you want to add a term to the SMQ or submit a request for a new SMQ? Did you want to make a change to an SMQ, maybe move a PT from one SMQ to another? And of course, PTs can exist and do exist in more than one SMQ. Do you want to make another update, maybe rename it? Change the algorithm, change the note. I mean, you have the option to do all of that. One note is that some organizations have specific folks assigned to be the ones who submit change requests. So it's up to the organization. So before you do anything on your own, I do recommend that maybe you reach out to maybe your manager or supervisor just to make sure. Say, I have an idea for maybe a change request for an SMQ. Can I submit on behalf of our organization or not? So maybe just that one pointer. But thank you for that question. Anything else?
Wonderful. I am not seeing any other questions at the moment.
Okay, wonderful. So, this is just a reminder that SMQs really are useful tools. They really help you in understanding your safety data. They really are a good way to interrogate your data, to maybe identify areas of interest for you before you submit to the regulator. I mean, they really can help you in your data mining and adverse event rate incidence reporting analysis. they have important uses, and it's always beneficial to you to be one step ahead and find information embedded within your data before they are shared with any outside partners or any outside regulators. So please take a look. Please start with a simple output. Like I said, it's a simple Excel sheet. You can easily run it. The tool is almost self-explanatory about what it needs to run, and start looking at your data. Hopefully you'll find this very useful. So last chance, Hannah, any last questions coming in?
No questions, just a couple thank yous for a helpful presentation.
Awesome. Well, thank you so much for your time today. Thank you for joining, whether it's early in the day or late in the day for you. We appreciate having you and wishing everyone a wonderful day ahead.